A huge part of how good medical care is hinges on how well the patient follows through on the guidance and advice from physicians. In the following video, we are going to discuss this adherence and non-adherence with a focus on what happens when people don't adhere and how we can increase this adherence. Adherence is defined as the extent to which a person's behavior matches a practitioner's advice. Your doctor tells you to take a pill X number of times a day and at such and such times. You are perfectly adhering if you take those pills every day at those times. However, people are never perfect. Anytime we deviate from this advice, we are engaging in non-adherence. In fact, non-adherence is extremely common. For instance, a large percentage of medication prescriptions are never filled. Sometimes this non-adherence is intentional, with patients deciding to completely disregard their physician's advice. One common instance of this is in antidepressant medication, where patients frequently take less than their prescribed dosage in order to avoid drug side effects such as fogginess or poor libido. Finances may also play a role in intentional non-adherence, with some patients feeling they can't afford the medication or treatment, leading to systematic health disparities. Besides intentional non-adherence, failure to follow advice and recommendations may be incidental. On one hand, people might modify or supplement their original treatment, leading to creative non-adherence. Unintentional non-adherence, on the other hand, is the full intention to follow instructions to the letter, but then either misunderstanding the directions or forgetting steps entirely. Birth control pills have notoriously high rates of unintentional non-adherence, with women either forgetting to take the pill for a day or changing up the time of day, which can affect the rate and effectiveness of hormone release. On a related note, a large aspect of sex education focuses on teaching correct use of barrier method contraceptives, which are also frequently used or disposed of incorrectly. Much of this creative and non-intentional adherence come from issues of communication. Both doctors and patients may assume baseline knowledge and fail to clarify directions. MedSpeak can exacerbate this issue as patients misunderstand or zone out, then feel silly asking questions. Thus, patients with lower medical fluency or who have English as a second language may struggle the most, leading to yet more systematic health disparities. These issues to adherence are particularly important because they can have far-reaching consequences. First and foremost, not following medical advice can result in continuation or recurrence of issues. For example, due to social and economic pressures, high school and college athletes commonly push their limits to get back into action before they are fully healed from injury, leading to longer-term issues than if the athlete had just waited. Non-adherence can also lead to overprescription as doctors see lack of improvement and choose to modify the dosage. This is common with antidepressants, where patients might not admit to not taking medications, thus psychiatrists may assume the dosage is incorrect. Once discovered, though, this non-adherence can negatively influence the physician-patient relationship, as both sides lose faith in the other. Non-adherence can also cause larger-scale issues, such as drug-resistant germs. People commonly fail to follow through on antibiotic medications after they begin to feel better, resulting in more resilient bacteria surviving and reproducing. We're also seeing how resistance to immunization recommendations are leading to isolated resurgences of diseases, such as measles. Thus, a major effort of health psychologists is understanding how to increase adherence. Provision of clear information and better overall communication between patient and doctor can help with unintentional non-adherence as patients understand the treatment better. Remember dentists and their cameras and friendly nature? That is to enable better communication. People can also use reminders or self-monitoring. For instance, modern medical technology enables doctors to follow up with patients to clarify treatment protocols. For intentional non-adherence, however, more active efforts at health behavior change need to be taken. For instance, increasing fear warnings to make non-adherence more scary than adherence. Incentives and rewards can also help increase the behavior, such as companies instituting fitness challenges. Increasing convenience and reducing barriers to adherence can also be extremely effective. For instance, our U.S. government subsidizes flu shot availability every flu season as a public health services, making shots freely available at most pharmacies across the nation. Modern medicine might also take a cue from complementary and alternative medicines, also known as CAM treatments. 36% of the U.S. population uses some form of CAM treatment. These constitute a group of diverse medical and healthcare systems, practices, and products that are not presently considered to be part of conventional medicine, including things like acupuncture, aromatherapy, massage therapy, chiropractic, homeopathy, and even some forms of yoga. These CAM treatments have received a lot of negative attention from modern medical practices due to lack of scientific evidence as well as their contribution to non-adherence as patients begin making substitutions or hear conflicting information. We should point out, though, that many modern medicines are actually a collection of previously considered alternative medicines that have just finally received validation through scientific methods. Specific forms of chiropractic and acupuncture are known to be beneficial in some situations. The major issues arise, though, when CAM claims become overreaching. CAM treatments are useful to look at because they often showcase high rates of adherence, as well as positive patient outcomes. Certainly, this is largely due to practitioner self-selection, but there are also other psychological and social mechanisms that promote understanding, open communication, and support for patients. The next video provides a case study of homeopathy, one of these CAMs, highlighting some of the challenges to the theory and application. However, more importantly, pay attention to the last half or third of this video and the description of the holistic and supportive efforts that homeopathy incorporates. These details are not unique to homeopathy, and we'll revisit them again.